Hello, this is Dr. Do again. This video is continue with the alphabetic list problem. I'll start with letter N. I started yesterday talk about neurological defect, neurological deficit associated with broad diseases. Broad list of diseases can cause neurological defect or deficit. And also I introduced about the arrangement of neurological system in terms of the motor versus sensational, or the upper central nervous system versus peripheral nervous system, and briefly mention some diseases are quite common, such as diabetic neuropathy. Today I'm going to continue with this neurological deficit or defect, just layered as different age group. What are the signs to look for? What are the common causes for different age group in terms of neurological impaired functions? So I'll start from the emergency situation. Again, if the neurological deficit causes muscle weakness, particularly cause the muscle weakness in the respiratory system, difficulty breathing. I mentioned there's some diseases can cause that. Or the neurological deficit in the older people with comorbidities. I mentioned so many times, each time I mentioned this, the risk of stroke, if that there are any sign of a neurological problem, like lost sensation, lost mobility, paralysis, or local or generalized, just need to go to the emergency. The sooner the better. The sooner the better, because of the time critical for the door-to-door to do the thrombolytic therapy. So anyway, I'm going to start from the age group, like newborn. What are the neurological deficit, and how to identify them? So for the infant, for the fetus, just immediately after delivery, you know it, the physician screen the fundamental neurological functions, check the reflex, check the hearing, and check the not quite developed, but the reflex are the mainly criteria. The examination, the physician will examine to make sure to check the neurological development. And with the growth, for example, growing, and I think as a parent, young parents, you probably pay attention to those developmental milestones. For example, by 3 months or by 9 months you cannot see it, then probably you need to talk to your physician about this. Your physician will examine whether there's some people, some infant or some child probably just sit late or develop late, but by 9 months they also have the average milestones for what the infant will do or the child will do by 2 years old, for example, cannot walk, or by 2 years old cannot talk. There's some delayed, but has to be evaluated if it is really far beyond the normal milestone. So that is the case. Really need to talk to your physician about the concerns and to examine whether there's any neurological problem during this development stage. So then for the young children, usually the cause of the neurological problem is, I think the genetics is one of the most possible, most risk factors, or during the birth, or from the sporadic or the genetic. So then, regardless of the cause, if the presentation you find is beyond the average of that child, you need to check with your physician. And probably it's normal. Like I said, individualized. Some people early, some people late. But I just want to make sure there's nothing going on pathologically, so to exclude any diseases. So this is for the children, either younger or older children. Just pay attention. Or for example, this is for the middle-aged or young adult. Like I mentioned before, the most common cause for neurological deficit or defects are the neuritis. The viral infection causes the infection of the nerves, called neuritis. Could be presented as localized tingling numbness, or if the neuritis occurs in the eye, you just feel the eye pain. these are usually self-limited, but you still need to check with your physician to diagnose, to exclude serious problems. Or the autoimmune caused demyelination, for example, multiple sclerosis or Guillain-Barré or any other kind of diseases after the viral infection cause this autoimmune reaction, target cell cause this the neurological deficit. So if that's the case, of course you need to see your physician to discuss. The signs I think I mentioned, or myasthenia gravis. So any of those, if you had this muscle weakness just without any cause, without any no causes, and also you just had a upper respiratory tract infection a couple of weeks ago, and you suddenly develop weakness or some neurological deficit in the face, or drooling, or cannot close your eyes, cannot open. These are also, that's the, like for example, the bowel disease. It's one of those occur in middle or early young adult out of the respiratory upper respiratory tract viral infection, start to have this neurological deficit in the eyes, in the face, cannot close your eyelid, or the drooling of your one side of the lips start to drool, cannot move your, cannot feel the sensation, cannot move your facial muscles. So these are the quite common in middle age or young adult after the viral infection. And for the older people, there are a variety of causes. Of course, I think I don't need to mention that. You probably know. The notorious, of course, stroke is one of the most common cause of a neurological deficit in the older people. The signs or the risk factors, I don't need to repeat it. You already know it. Past medical history, hypertension, diabetes, hyperlipidemia, etc., etc., you know it. Or the diabetes itself can have the neurological deficit, usually occur in the peripheral nervous system, loss of sensation on the extremities, and that increase the risk for the infection of the foot and also the shin area. So these are for the adult. And regardless of age, just cross or tumor, cancer, of course, is another cause. It depends on the age group, may or may not the most common cause for the neurological deficit. For children or for young adult, for older people, all can have this cancer caused or tumor caused neurological deficit. Usually it depends on the age. It could be malignant, could be benign, but any sign of this neurological disease caused by the tumor occupant disease in the brain, then you have the problem, the symptoms are probably from the subtle to suddenly lost movement of the extremity, or from the subtle loss, tingling, sensational change, and eventually, or the vision change. These are all the signs of those tumor occupant disease that occur in the brain. So this is a kind of very vague or broad coverage. I'm not specific talk any neurological disease. It's just in general what to look for this neurological defect for different age group, what are the risk factors. So I hope it helps, and I have some previous video on these peripheral neurological diseases, and going to probably post more later on. But this is for today, and I hope it helps. And thank you for watching. I will see you next time.